Okay, let's talk about the crosswalk. When I think of a crosswalk, I thought of this picture here. Okay, that's just me. And the crosswalk, when we go from one set of codes to another, it would be nice if it was just a straight crosswalk. Okay, ICD 9 to ICD 10. The problem is, folks, and I want you all to understand, because I hear people out there, just got an email during lunch, I was looking at it there, I go, okay, you took this person's class. Because they're teaching this here that it's a straight line, but it's not. In fact, ICD 9, in most instances, it goes from one code to many. Sometimes it goes from many codes to one, and other times it just doesn't, there isn't any direct translation. There are apps out there. You know, Find a Code is one of the apps. They don't work. They don't work because of these conversions, okay? So the conversion here, again, sometimes it's an exact match here. Sometimes it's a reverse match. There's a lot of combination codes that we as chiropractors are going to use, and there's some approximate codes as well, okay? So the term, and if you are reading about ICD-10, it's like another, here's Rosetta Stone, ICD-10, okay? The conversion from 9 till 10 is called the general equivalent mapping, the GEM, okay? So when you read about that, you're going to know that is the conversion. And again, the conversion, the dictionary to bridge the language gap here is not a one-to-one. In fact, this is one of the rare things, which, you know, here I teach you the rare one, you go, oh, cool, and then I told you don't use it, right? All right? Welcome to my class, okay? And that's because cervicalgia is at M54.2. Now, it's M54.2, is it XXA? Why? Pardon? It's an M code. Boy, you see? You're getting it. It's that easy. Yes, it's that easy. The M codes, which stand for what? Mario. And Mario makes it easy for you, okay? Very good. Okay. We need a PB code in there for Parker Binder. Okay, all right. Here's sciatica, by the way. Okay, so now we have sciatica, unspecified side. Do you expect that to get paid? Okay, very good. Okay, we have right sciatica, we have left. We have sciatica with lumbago, unspecified. Is that going to get paid? No. Why? You're telling the insurance company they got back pain and sciatica, you know, pain going in the leg. I just don't know what leg. But I did a level 5 exam. Sure you did. Okay. All right. You laugh, but that's what we see. All right. Okay, so now these are the current codes for the subluxation, by the way. 739.1 is cervical. 0.2 is, of course, thoracic. 0.3, lumbar. It gets a little muddy after that. 739.4 is the sacrum or sacrococcygeal joint. The SI joint, ilium or SI, sacroiliac, is 739.5. The SI joint is one region. That's why when you come in there, hi, I'm Dr. Mario Fuccineri. Welcome to our office. How can I help you today? Well, I've got pain in my neck, my mid-back and low back, and my hip hurts, and ooh, my tailbone hurts too. I don't know about you, I say, let me introduce you to my associate, Dr. Ponica, okay? All right? Either that or it's a full moon. I'll wait, let's reschedule you for a couple days from now when you're normal, okay? All right? In other words, how often does a patient have pain all over? You know, maybe if they went, I jumped out of an airplane, my chute didn't open, and now I got pain all over, and they call me flatsy. I mean, that's fine, okay? All right. So now, when we look at the codes, these are the equivalent codes. And you look at this, and it's these S codes right there, okay? But these codes are ridiculous, right? It's like, here's the subluxation code for C4-5, C5-6, C6-7, right? All right? Are these the codes you're going to use? No, because you're going to use the Mario codes, the M codes. And the M codes make it nice and easy. Medicare has already indicated these are the codes they're going to use. Now, you can look at your notes, you can look up here, or you can just learn it like this. Okay, just watch. You guys ready? A little quiz. Okay, subluxation, ICD-9, subluxation, cervical region, 739.1. So it's M99.01. Okay, nice and easy. All right. Lumbar, 739.3. Okay, unless you went drinking during lunch. All right. And so now it's M99.03. You got it. And there it is. It's nice and easy. Now, did you ever look at an x-ray report and it says, and especially these lawyers, the lawyers, I was teaching Galveston, Texas, right? And so there's a room, probably, it was 180 people in my room, a little smaller than this here. There were about 1,000 trial lawyers next door to our class, okay? Because they go to class too. And, whenever, it's kind of like, if you've been in practice long enough, and not that I have, a huge PI practice, but I do enough depositions, a couple per year, and it's like they start going down that path, and you go, oh, you took that class too, right? Okay? And, doctor, the x-rays here, are you familiar with this radiologist from Decatur Memorial Hospital? Yes, I am. And would you say that as a respected radiologist? What am I supposed to say? No? Yes. Would you defer to their report? Yes, I would. And I can always tell them the next question. And it says here that there's no subluxation, so that means and you said there's a subluxation, and it's like, and so I've got my canned answer that a subluxation in the medical term is a dislocation, whereas in a chiropractic term, it's a small or partial dislocation, which is a misalignment, right? Okay? All that, you're going to say, Counselor, did you take Mario's ICD-10 class? Because under ICD-10 now, what we do is called a segmental and somatic dysfunction. Medicare already renamed it, okay? And so now, no longer is it officially the subluxation. Yes, good, all right? So now, the subluxation, so therefore, a 739.2 is now an M99.02. You already know it, it's already there, and so you make the conversion nice and easy, okay? All right. All right, so we went through sprains enough. I'm not going to go through that. Okay, now, here it is. Okay, trigger point, people. Okay, here it is. Because if you think about it here, a myofasciitis and fibromyalgia, are they the same thing? No, fibromyalgia is huge. For fibromyalgia, they have trigger points above and below the waist. At least, I think it's 11 of them, right? Above and below the waist. So myofasciitis is basically the one region. Fibromyalgia is all over my body, okay? All right, so they're not the same, but yet it's the same code, 729.1. So here you go right here, and so myalgia, myofasciitis there, and fibromyalgia are split up, all right? Okay, now, here's another rule, and if you will, it's a Mario rule, okay? Any diagnosis code, ICD-10 code, write it down because it's not specifically there, but this is kind of a code to help you out. Any ICD code ending in a 0 or a 9 is not good. Those are your unspecified codes. Any ICD-9 code ending in a 0 or 9 are usually an unspecified code. It's not that you can't use them, it's just you want to stay away from it. So in these codes right here, M60.9, M79.1, M79.7, which one has a red flag on it? The first one, M60.9, and so there you might want to look it up. And it might be myositis, but instead of unspecified, now it's going to be a specific region, and that's going to be the other code. So when you see a 9 or a 0, it's going to cue you in that there's probably a different code you want to use. Okay? Everybody with me? All right. Okay, very nice. Okay, now let's go to chapter 13 now. Okay? So we finished with all the general rules, the definitions, and so far you've survived, and you're actually answering the questions correctly. You're not giving me that, deer in the headlight look, okay? All right, so chapter 13. Now, M refers to diseases of musculoskeletal system and connective tissue, and then there are the Mario codes. After the letter are two numbers separated by a decimal, which that letter and then the two numbers, what's another name for that? What do we call that? The family, okay? All right, the family. All right, so it was also on The Sopranos. Okay, all right, okay. So that's that. Now, here is an example, and I know it's kind of small. It doesn't matter, okay? And these are all of the different ways they split it up, all right? It doesn't matter. I just want to tell you this. So, site and laterality, we've already kind of talked about this. For some conditions where more than one bone, joint, or muscle is usually involved, such as osteoarthritis, so here is another Mario tip, if you will, is that in cases of osteoarthritis, and I've looked through all of the codes there, osteoarthritis is the one we will most commonly see, where it's in multiple areas, then it has a multiple site code. So osteoarthritis, look for multiple site codes. All right? M codes, all right, those are your subluxation codes, don't require 7 characters. Usually 4, 5, 6 maybe. All right? All right? That's common rules. All right? Okay. So, code by site first, then the condition. The site indicates the bone, joint, or muscle involved. Now, there might be multiple site codes, and the reason is because if you say forearm, ICD-10 might tell you it's forearm and wrist, or it might be forearm and elbow. And so sometimes, if there is a disorder condition that it usually involves, osteoarthritis is the one that we're talking about here, that usually involves multiple areas, there you just have a multiple joint or a multiple site code, and they just gave it to you to be easy, okay? All right, okay. All right, so arthritis, osteoarthritis, that's what you kind of think of there, okay? Now, primary arthritis is wear and tear. Now, I just read over this again, and in this case here, it was a Blue Cross in one of the magazines I subscribe to, and they went through this here. And so what I want you to understand, especially if you have a sports medicine practice, primary arthritis is wear and tear osteoarthritis, whereas secondary arthritis is usually caused by an injury, okay? Hereditary obesity. Now, if you think about what I told you, now you'll see where it makes sense, all right? Secondary arthritis is caused by an injury. What is the cause of the problem? The injury, right? Okay? And so therefore, the injury is the problem, and the arthritis is a sequela. Very good. And that's why it's called secondary arthritis, okay? The codes that you look up, and especially those of you that do sports medicine, it's going to be, there are different codes for primary and secondary arthritis, which, we could spend 4 hours just on that, which I'll be drinking, and I don't drink. Okay, so, all right, okay. All right, okay. Rheumatoid arthritis. Okay, now, this here is kind of important, and I see a lot of rheumatoid arthritis in my practice. Okay? As a chiropractor, we'll see rheumatoid arthritis, because where in the spine does rheumatoid arthritis affect? Only one spot. It's cervical, but even more specific. C1, that's right, okay? So C1, and patients come in and say, I have rheumatoid arthritis, I don't know if you should be treating my spine. So I'll give them the rheumatoid arthritis, spiel, all right? And so it's C1, so you probably don't want to do the LB maneuver. Okay, for those of you that have been around for more, that's Linda Blair exorcist, okay? Circle in the head. All right, okay. All right, so you probably don't want to be doing that. So rheumatoid arthritis is broken down, first of all, by site. Are there multiple site codes with rheumatoid arthritis? No. No. It's osteoarthritis, not rheumatoid, okay? So if the patient has rheumatoid arthritis of the knee and they have it of the thumb, you're going to be diagnosing both areas, all right? Now, when you do rheumatoid, when you're looking up and studying rheumatoid arthritis, if you do blood work on it, what shows up in the blood work? Okay, it's called a rheumatoid factor, all right? Now, to have rheumatoid arthritis, you have to have the RF factor there. No, it's only when it's active, okay? And so now it's broken down by site, laterality, any complications that they might have. Because a patient might have rheumatoid arthritis of the thumb, and then we have other where it's all deformed, right? That's a complication. And then is there with or without rheumatoid factor? And yes, all of those there will have to be built into the diagnosis code. Now, how many patients are you treating that you're going to diagnose them as a primary code with rheumatoid arthritis? Probably not that many, correct? Right? Okay, so don't fret about it, but depending, I give that to you only because depending on the type of practice you have, that you're going to have to break down that code. It is much more specific. All right. So bone versus joint for certain conditions like the forearm and the tibia, you want to designate the bone. Okay? All right. Okay. Acute traumatic versus chronic or recurrent, which one will go first, acute or chronic? Acute. Okay? Very good. See, already I've told you this and you're learning it and we're going through it rather quickly here because you already know it. Okay? All right. Okay. Okay. All right. Okay. Inclusion terms. List of terms is included under some codes here, and that would be the included codes. So inclusion terms, included codes. Unspecified codes. Ooh, Mario, you said that word again, okay? Unspecified codes, and a code with a fourth digit, 9, or a fifth digit, 0 for a diagnosis is usually unspecified. Try to stay away from it. Now, I'm giving you these here. I've already taught it to you. Now you see it in writing. It's a piece of cake. We'll actually go over some examples, okay? So in ICD-9 here, you'll see the ICD-9 code. The A, which is like 722, that is the family. The B tells you, like 722.10 is a disc displacement of the lumbar region. You're already dealing with that, okay? In ICD-10, we have the family, then you have the site or the origin, the etiology is in B, and then the C are the Lenny terms, right? Okay, and that is the extension there. It tells you what phase of care they're in. Just look at it that way, okay? All right, so now, I know you're tired. I want you to help me out here, okay? And so this is what I want you to do. Okay, you ready? Now, there are certain people that take a class, like you guys here, and there's other people who register for a class, but they're sitting out there on their cell phone. And I want you to help me to make them wonder, holy E. coli, what did I just miss? Okay? All right? You ready? Okay? So everyone raise your right hand. Come on. You got to do it. Oh, come on. Don't look like, get some coffee. Jeez. Okay. All right. Now, at the top of your lungs, I want you to yell out so that they hear you, we are number one. You ready? Okay. We are number one. That's right. All codes for laterality that end in a 1 are for the right hand. See, look, he came in. And look, here's another one. All right, okay, see? All right. Okay? All right, now, okay, there's some hanging out over there. I saw them earlier, okay? You ready? So raise your left hand and come on and say it really loud. Now, louder so that all these people sitting up watching basketball upstairs will come downstairs to see. And just say, we are number 2. You ready? We are number 2. That's right. Left hand is always number 2. It's that easy. Okay? Do we have any certified professional coders here? Okay? My wife is one. okay? It's not that hard, okay? She's a certified medical compliant. No, but listen to what I'm saying. Listen to what I'm saying. You don't hear what I'm saying, okay? She's an MCSP, Medical Compliance Specialist. Now, she took the class. She slept with the instructor. That was me, okay? All right? But the national boards, I never see she passed the first time. The CPC, okay, she studied, walked in, did very well, passed the first time, all right? That's nothing compared to chiropractic school, all right? It's nothing compared to national boards, right? Okay? You got this down. It's not that hard. You will get through ICD-10 just fine, okay? Let me prove it to you, okay? You ready? Okay, so what code, when it ends at certain numbers, what numbers are those that are unspecified? 0 or a 9. Okay, all right. So here it is, stiffness of the shoulder. I don't know where. It's an M25.619, okay? All right, so now the next one. Here it is, quiz. Stiffness of the right shoulder, what's the code going to be? M25.61. You got it. It's literally that easy. So easy, even a CPC can do it. No, okay, all right. Okay, what's the left shoulder? M25 point. You got it. And literally, now, there are a couple exceptions in the foot with 5s and 6s. You see, he came in now, okay? All right? Okay, we were just talking about you. Never mind. All right, okay, so the key is, if you just remember, we are number 1, we are number 2. Yes, that's a Mario thing, okay? And so that will get you much further. Now, a little disclaimer here, okay? I have not x-rayed anybody in this room. I don't know if you have a right and left spine, but I'll bet you only have one spine, right? Okay, right? Okay? So, with the spine itself, okay, let's go through here. The spine is different than extremities. The spine is by levels. All right? So it's not a right and left spine. Okay? Now, what I would do if I were you is I would go ahead and print this up somewhere and put it by your desk, little laminated thing. You will use this a lot. And this is it here. A spondylolysis, as an example, is a defect of the pars for the non-chiropractors in the room, okay? So it's a defect of the pars. So now the doctor will have to be specific. Okay, staff, where are my staff? Staff, raise your hand. Okay, are you here with your doctor? Okay, look at your doctor. Look at your doctor. You got to do it and say the following. Don't waste my time. All right. Because your staff, their time is as valuable as yours, doctor, okay? And they don't want to hunt you down asking, is this the right or left side or what level spine it is, okay? All right. So, don't waste their time, all right? So, here are the different levels of the spine. So literally, multiple sites in the spine, it's a 0 or a 1. Very rare, very rare. Okay, we have occipital atlantoaxial region, cervical thoracic, thoracolumbar, lumbar, lumbosacral, sacral, and sacrococcygeal, and then site unspecified 9. Okay, that's right. Gosh, you guys are just eating this up. All right, cool. All right, so little quiz here, okay? You ready? Okay? All right, so it's an M43.00, which means since it ends in a 0, it's unspecified, okay? All right, so now if I ask you, and you see here, the excludes 1, congenital spondylolysis. Now, does that mean that, and spondylolisthesis here, does that mean you're going to use that along with this or instead of? Very good. You see, you're learning ICD-10. Excludes 1 tells you only 1 code. Excludes 2 tells you could use 2. So a spondylolysis of cervical region. Now, if we go back to my little thing here, what number is the cervical region? A 2, okay? So we said it was M43.0, and now what's it going to be? M43.02. That's it. You got it. So number 1, if the doctor identifies the level and you have this little code sheet in front of you, laminated or whatever by your computer, you automatically know the code. Okay? No, because there's only one spine. So unilateral, bilateral, right and left only is for extraspinal and not for spine. Everybody got that? It's only extraspinal, not for spine. All right, how we doing? Okay? Starting to make sense now? All right, okay, and we haven't even got to the fun part yet, okay? Just wait. Okay, all right, so here's an example. Let's go back to some examples that I had here, just to kind of go through it. Okay, so looking at my little example, it's not in your notes, but nonetheless it's there, okay? So we have a M25.53 pain in the wrist, all right? So here we have a M25.539 pain in unspecified wrist, okay? That's right, you're not going to use that. And so, everyone raise your right hand, we are, there it is, a 1. If you look at the right side all the way down, you see it ends in a 1. Do you see that? And that's why that rule holds fast. Pain in the left wrist, it ends in a 2. We are number 2. And if you look down, there's always a 2. All right? And so that rule holds fast. Now, here we have spinal stenosis, and we know that spinal stenosis is one of the approved codes in Medicare. All right? And so now these are M codes here. Do you have to have a Lenny code? No. So you don't need an AD or S. Now, if it had an S code, and sometimes there is a corresponding S code. Now, what do I mean by that? If we look in the chapters, okay, chapter 13 is with the M codes, okay, and those codes there, those codes don't require an AD or S. But that is like a nerve code, just like the G codes are a nerve code. Okay, so let me give you an example. We have G codes that are sciatic nerve codes. We have S codes that are sciatic nerve codes. So which one will you use? The one the carrier tells you to. Does that mean that certain carriers like Blue Cross and Medicare might be different? Yes. Okay. Does it mean that everyone might follow Medicare and be on the same page? Yes. Okay. So therefore, you will have to see how the carriers clarify what they want to use. The codes are there, but the carriers are going to say, this is the way we want it with these codes. Just like procedures, the procedures, if you look at it this way, you have what you were taught in school as a chiropractor. And that's your scope, if you will. You have what state law gives you. That's your scope, if you will. And then you have what the carrier allows you to do. So which one of those trumps everything? Okay, what you were taught in school, what your state allows you, or what the carrier says is allowable? Pardon? It's actually the carrier. Because when you, as an example, when you sign a contract with a PPO, if the carrier says that decompression therapy, that is not a 97012, then can you bill it as a 97012? No, okay? And by the way, when you have a therapy code, that's the CPT code, okay? The CPT code that is in an unspecified code is 97039, okay, 97039. A lot of times the CPT codes, which don't change that often, don't keep up with the technology. Okay, here's a prime example, 97035 ultrasound. Okay, so you put some frosting on, right? Put the sound head down, and now you rub it around, that's a 97035. But now they have machines where put the frosting down, put the sound head there, you lock it in place, and you walk away. And they do ultrasound, and now no CA is needed. Isn't that nice? But it's not a 97035 because a 97035 is an attended code, and that's unattended. Blue Cross they actually in their CPT assistant magazine made that distinction and said that is not an ultrasound. So therefore, you have to use a 97039, okay? So that's why it is incumbent upon you to read the carrier's medical policy. And Blue Cross has a medical policy. Aetna has a medical policy. Does Medicare have a medical policy? Absolutely, and that's called the Local Carrier Determination, LCD. So for you guys here, if you go to Palmetto's website, all right, Part B, that's your office, all right, and now you look under Active Policies, you scroll down till you hit Chiropractic. All of you should, in your little compliance manual, you should print up that policy, the LCD, and it's 14 pages long. That's basically what your carrier tells you you can do. Now, is your carrier the same as my carrier? And the answer is no. No. Back in the day, I started teaching Medicare back in 1995. That's when I started teaching Medicare. And back then, Medicare is Medicare all over. Now, I'm still teaching all over, but I have to learn Medicare Palmetto. Next month, I'll be in Georgia teaching. I'll be teaching for South Carolina in June, first weekend in June. I'll be in Alabama the very next weekend teaching there too, and I have to learn all the different carriers' LCD. You just have one. Because now Medicare says, we are so big, we don't know what one hand is doing there, and so each carrier, check with us, but this is what we want. You then determine it. And that's why every rule that I give you here, I'm telling you this because you need to check the carriers. When I hear of a carrier, and I get feedback there, I'll post it on my website. H&S, when it's one of your carriers that they deal with, I'm sure we'll post it on their website. You can't just be a hermit anymore. You have to be there to find out what's going on, okay? All right. Okay, any questions so far? All right, you've been a very good group here. And again, even I can give you example after example, but pain in the right knee, not a great diagnosis, but again, it just right is 1, left is 2, okay? All right, okay. Okay, let's jump back to, here. Okay, so M43 point, and then again, here are the different regions that I was telling you about. Remember, cervical, I told you, ends in a 2, and here it is, spondylolisthesis, M43.12, all right? And that's why this right here, which you should have in your notes there, in my book, it's there as well. Take that, copy it, and laminate it, just have it there. The 1 and 2 you can remember, but these might be a little difficult, okay? All right. Okay, migraines, I can't go through all the migraines here, but again, what I wanted to point out with migraines for you doctors is that now, with aura or without, for a migraine headache as an example, there are actually 32 different codes for migraine headaches, okay? I happen to have them in my book, but the reason why I'm bringing it up is the documentation. And so now you're going to have to be more specific on your documentation, all right? Intractable, what does intractable mean? Okay, is it relieved with medication or not? Okay? With or with status migrainosis, and again, intractable means it's not relieved. Migrainosis is, are they having visual disturbance or not? With vomiting or without, as well, photosensitivity, is it menstrually related, which might be hormonal, okay? All right. Okay, so let's look at this. What is the term for the crosswalk from ICD 9 to 10? Okay, it's the GEM, or general equivalent mapping, okay? The patient presents with the lower back and bilateral leg pain, numbness and tingling in both legs. Straight leg raise test is positive bilaterally. For sciatica, you suspect disc involvement at L5. What is your written diagnosis? What will it be? It's going to be sciatica, and the reason why I asked you it this way here first is I want to make sure you don't put down disc displacement, because you suspect it, but you can't put that on your claim form. And then code the diagnosis. Well, I gave you those codes before, and if you look them up there for your sciatica code there, and that would be for bilateral sciatica, you're going to use M54.41, which you know is the right side. M54.42 is the left side. Rheumatoid arthritis coding requires site, laterality, complications, and the RF factor. If you are diagnosing arthritis in multiple sites and there's no multiple site code, what do you got to do? Each different site individually. Okay, what is the ICD-9 code for sciatica? Now, this is why I put this in, okay? When I first, I learn as I go along, and I had this quiz in there, and I was teaching a class, not very big, but big enough, and it was a mixed class, and the doctors they knew sciatica, but they didn't know the codes. And to give the staff in the room, I gave them what the findings were. They had no idea that it was sciatica. And so that just goes to show that in our office, we have an exclusive type of role, and together, it's like a baseball team, we each have a role to make up as a team. All right? And so, doctor, and I just implore you, I ask you here, your documentation has to be more specific. Do I love doing documentation as I have to do? No. I'd rather just treat and just go on, but unfortunately, risk management, okay? And number one, and number two, you got to get reimbursed. And staff, you would just like it if the doctor used one code and only one code, like the office that I looked at on Thursday where he used 2 codes, and that was it. One for the cervical, one for the lumbar, and subluxation on everybody. But you know what? As my wife had, when we were done, my wife goes, boy, that'd be an easy job as a coder for that office. You know? All right? Okay. So the ICD-9 code for sciatica is 724.3, and so therefore, you'll just look up the code and convert over. Now, these are easy, and again, I know you don't have it in front of you per se, but look, what is the preferred ICD-10 code for subluxation of the cervical spine? So again, little workshop exercise here. What is the ICD-9 code for subluxation of the cervical spine? 739.1. So therefore, what is it in ICD-10? M99.01. It ends in the same number, okay? And so get used to that because now you can do it without having to look it up in a book, okay? Just like subluxation at T12. Now, subluxation at T12, unlike a disorder at T12, because T12 would be a thoracolumbar region. That's a transition area. But for subluxation, it's T1 through T12 is all the same code, and it's 739.2. Don't be bashful, okay? So what's the ICD-10 code for a subluxation of the thoracic region? M99.02, okay? 02, okay? So now you got it, okay? It literally is that easy. But you know what? You're going to have to train and retrain, okay? And so, you know what? Doctors, have a little short meeting. You know, it doesn't have to be a big deal. Have a meeting with your staff, and so when you have the meeting with the staff, Jimmy John's delivers. They're pretty quick, I hear, okay? So, just say, okay, little quiz. Or maybe have the case of the month or whatever. We don't have months, okay? You got weeks, okay? So case of the week, and just start to get them used to doing that, okay? All right, okay. What I'm going to do is I'm going to go over obstetrics, and then we'll take a break, okay? Okay, you guys ready? Yes, questions? Okay, I'm sorry, say it again. What's MDD? Oh, okay. Yeah, okay. Okay, so M99.01 versus .02, is that what you're asking? Okay. I don't think there is a M99.10. Oh, okay. This is why. M9, okay, what he's asking is 739.0, what's 739.0? That is a subluxation of the cranial bones, okay? Of the cranial bones, not a covered Medicare service, okay? So therefore, the gem for that, M99.10, okay? All right, that's all it is. Okay, questions? Okay, and I'm sorry, because you got it, because some people are talking. So if they don't pay for, okay, so look at it. She said, if they don't pay for unspecified codes, why have them in the first place? Okay, so number one, there are instances where they will pay for unspecified codes, such as like a sprain of the ligaments of an ankle. Okay, but remember, who made these codes? The World Health Organization. All right. Now, and that's an excellent question if you think about it here. And let's think about it. The way that a coder is trained, a CPC, in the CPC examination, you are given a scenario. Here are the doctor's notes, code from that. Only in chiropractic have I found where the doctor said, in order to meet this code, what do I have to put in my documentation? Okay? So it's not the same, number one. Number two is when you go back to the root, you have the family, and then after that, now you have the extensions, and then it gets more and more specific as time goes on. It's for global data. So if the doctor, and there's, in the world somewhere, there's a doctor who's writing down sprained ankle and not right or left. And so they have to have a way to diagnose that to use it in global data. Again, we are being more specific because there is a reimbursement being tied to it. But, why do they have an S13 if you will never get reimbursed for an S13? Well, the S13 is the family. Then after that, then we become more specific, unspecified, and then after that, we become even more specific with right and left or the vertebral levels. So when you look at the whole scheme of things is they start from very unspecified, go to a more specific code all the way down here. And so it's kind of like the systematic way that they use the coding so that when you look at the book, you're going to start off with family and go down. Now, what we're doing is we're getting that big bad boy book there, which is used for global data. And you know what? The actual book is 70,000 codes. Now you take 70,000 codes, and now we convert it to those codes in the ICD-10 for United States. That's the CM codes, clinical modification. And now what we're doing is we're converting it even further, or as Parker said earlier, drilling it down, making it just for chiropractic. Okay? So here is the system now fit into the system, and that's why. Okay? But again, keep in mind that unspecified codes are not preferred codes, but sometimes that's all you know. Just like lumbalgia is not a preferred code, but sometimes you might have to use that because I just don't know what it is. Not yet, till I get the x-ray report back, okay? And so that's why you always have these more unspecified type codes, okay? All right. Any other questions? Yes, sir. Yeah. Well, in your scenario, let's go to ICD 9 land, okay? All right, so patient is whipping her hair around, or maybe it's a male and he thinks he's Fabio, okay? All right, okay? So he's like this as he's on his horse, okay? All right, because he just got out of the water, okay? And he has no shirt on, him and Putin are together, okay? All right. So, I know, my brain is weird. Okay, so he does that, and oh, my neck is hurt, right? Okay, so he has a cervical sprain, okay? He's got spasms. I would never diagnose the spasms because that is a symptom of the problem, okay? If I'm going to do trigger point therapy, maybe I'll give it a 729.1, but even then, for an acute care, who cares? I probably won't do it, okay? So most probably, I'm going to give him at least an 847.0, and maybe if there's any other complicating factors such as degenerative disc disease or long hair, then I would give those as complicating factors, okay? So going back to your premise, I probably would have had just a sprain injury, 1 or 2 codes, instead of all those. And so in ICD-10, I'm just going to have probably the sprain injury. Now, if we look at the sprain under ICD-10, which ligament did he sprain? Who knows? I don't have an MRI. So now I'm going to use an unspecified sprain. You could. You sure, you could. Now, segmental dysfunction, depending, when you get a bunch of geeks in the room, you get geek opinions, okay? So, the subluxation, is that a cause of the problem or is that a result of the problem? In other words, when he's shaking off his hair, did he form a subluxation? So that might be a sequela, but it's not, except in Medicare, not the primary diagnosis. So I can have it later on down in the list. And so if you want to put it, I would say for a non-Medicare case, put it in there if you wish, but don't put it number 1. Okay, that's fine. And so in that case, it would be a M99.01 because it's cervical, okay? All right. Anything else? All right. So rather than going through obstetrics now, because some of you, your bladder is so full, you feel like that picture up there. So I'm going to let you take a break now, okay? Anything, okay? All right, so on my watch, it would be a 10-minute watch. I don't know what it is on yours, but a 10-minute break. So go to the bathrooms and Kegel, which is push.